Chapter 15 is on the nervous system. That's my personal area of specialty. We're also going to be including behavioral health because these are most likely disorders of the mind as well, so that's why they are lumped together in this nervous system chapter. We're going to start with a background to get you familiar with the nervous system, its components, its function, and then we will move on to the medical terms. The nervous system is comprised of your brain, your spinal cord, all the nerves in your body, and there are two major components of the nervous system. There's the central nervous system, or CNS, and that's the brain and spinal cord. The peripheral nervous system, or the PNS, is basically everything that's not the brain or spinal cord. It carries all the information to the rest of the body and communicates from the spinal cord to the rest of the body and back again. When you think about what the nervous system's function is, it does a few different things. It's basically a giant communication highway. So it communicates what you want to do with your body, and your body sends signals or inputs back to the brain. It coordinates all of your body functions and movements. It can detect changes. So it evaluates your surroundings and sends signals to your muscles in response. For example, if you put your hand on a hot burner, well, then you'd send signals to your brain that that's really hot, and then your brain would send signals back to quickly remove your hand. Your nervous system gives you other mental activities, so it makes you think, gives you memory, emotions, and those are just a few to name. So now we're just going to give a quick breakdown of the brain itself and the brain's parts, as well as the spinal cord. The brain consists of a few different areas, and it's contained within the cranium. The major or largest portion of the brain is called the cerebrum, and you have two hemispheres, a right and a left side, and that pretty much controls most of your body functions. All the muscles, it interprets your senses, your sight, your hearing, your memory, your emotions, all of that takes place in your cerebrum. You also have what's called ventricles. These are open spaces within the interior of the brain, and it's not hollow, it's filled with cerebrospinal fluid, or CSF, and that cerebrospinal fluid flows between the brain and the spinal cord. It acts as a shock absorber. So it helps to cushion the brain if you ever hit your head, to absorb the shock so you minimize injury. And it also transports nutrients and gets rid of waste because it circulates through the brain and the spinal cord. The cerebellum, often called the hindbrain or mini brain, is located under the back part or posterior portion of the brain. This is where your coordination and balance come from. So if you had an injury to this portion of your brain, you wouldn't be able to balance or coordinate your movements. The brain stem is a stem-like portion that acts as a connector. It connects your brain to your spinal cord. Two key parts of the brainstem, one of which is the pons, which means bridge, and its job is to connect the cerebrum with the cerebellum and the brainstem. So it acts as a connector joint between those three areas. We also have the medulla oblongata, and that one is a very important brain center that controls your breathing, your heart rate, muscles in your blood vessels, and also helps establish your blood pressure. So it's a very vital portion of your brain region. If you were to zoom in on your spinal cord and look at a cross section, there are a few different layers. And these layers of covering are called the meninges. And these meninges cover both the brain and the spinal cord. So the tough outer layer is called the dura mater, which literally means hard mother, because it's the tough outer layer. In the middle, you have what's called the arachnoid, which is this spider web, fibrous looking layer. And underneath it, we have what's called the subarachnoid space. It's a space that is below that arachnoid level. And then on the innermost layer, we have the pia mater. Again, the brain and spinal cord are wrapped in these three levels of protection. I'm not going to get too much into it here. This slide describes your peripheral nervous system, so the nerves running from the brain and spinal cord to the rest of the body. A few examples are your cranial nerves and your spinal nerves. Here is a picture that shows the different cranial nerves. So it shows you where the nerve comes extending out of the brain and where it innervates within the face and what it actually controls. The basic unit of the nervous system is called a neuron, and its job is to conduct nerve impulses from one spot to another. And it's important to note that once these neurons are destroyed, that's it. They can't be replaced. So once these brain cells die, they can't be replaced, which is why a number of degenerative disorders eventually lead to death, because these cells can't be regenerated. Okay, we finished all the background. Now we can finally begin to look at the combining forms for the nervous system. Most of these words are pretty straightforward with the anatomy that they represent. For example, cerebello goes with cerebellum. Cerebro goes with cerebrum. Duro means hard, so it could reference the condition of being hard, or it could also reference dura mater. Encephalo means brain. Ganglio or gangliano refers to the ganglion, which we noticed in that slide I didn't talk too much about. We also have glio, which goes for glia, those little helper cells. Meningo and meningio both mean meninges. So it's not pinpointing one specific layer, it's targeting them as a whole. We already saw myelo in the musculoskeletal chapter, which means spinal cord. Note that radico, radiculo, and rhizo all mean nerve root. And this is basically the end of the nerve that's close to the spinal cord. You can see your pictures on page 652 for a reference. Moving on to the prefixes here, these ones are a little tricky because they don't really look like what they mean. Aesthesio has to do with a feeling or a sensation. You can imagine a lot of diseases or disorders where you might lose sensation in a part of the body. Mento and psycho, both of those mean your mind. So if you think about mental or psychotic, both of them have to do with your mind. Mono means one. Phaso has to do with speech. Certain brain injuries make you unable to speak, so you would say phaso, or phasio. Polio references specifically the gray matter of the brain, and we'll see that used in a few words. Quadri means four. Note how it's not quadro, it's quadri with an I. We have a few suffixes here. Iatrist and iatry go together. An iatrist is a specialist physician. We learned previously that a logist is a specialist too. They both mean the same thing and can be used interchangeably. Iatry is the area of specialty for someone. So a psychiatrist would study psychiatry. Ictal means a seizure or attack. Again, certain brain injuries could lead to seizures, which is why we have ictal. And paresis or paralysis has to do with slight paralysis. So if you are slightly paralyzed in a certain area of the body, you would see paresis. Not to be confused with plagia, which we'll see later on in the chapter, which means total paralysis. Here I just want to point out to you that myelo has actually two completely different meanings. In chapter 14, we learned that myelo meant bone marrow, but in chapter 15, we learned that myelo means spinal cord. So it depends on the context of what you're talking about as to knowing which one you are referencing. Also, we are introduced to paresis as a suffix, which means slight paralysis, so kind of a weakening or a tingly feeling, whereas the suffix plagia would be complete paralysis or no feeling. Now that you have the basics down for the nervous system, we're going to begin to put together all the word parts to create diseases and disorders. Then we will move on to those that are not built from word parts. Here is the first half of the list of the words built from word parts. Most of the suffixes here are reused several times. For example, itis, we've been seeing a lot now. Hopefully you remember that means inflammation. So you could have cerebellitis, inflammation of the cerebellum. You can have duritis, which is inflammation of the dura, encephalitis, which is inflammation of the brain, and so on. Here we also have myelocele, which means softening. So, for example, encephalomyelocele is softening of the brain. Let's see. We also have several omas. Just like any other area of the body, you can have tumors in the nervous system as well. So glioma would be a tumor of glial tissue. A glioblastoma would be a tumor of developing glial tissue. And a meningioma would be a tumor of meninges. I do want to point out here that there are a few word parts that haven't been introduced to you before, so I would like you to make a special note here. In the term cerebral thrombosis, we haven't specifically talked about thrombo. Thrombo is a combining form that means clot. So a cerebral thrombosis means that you have a clot in the cerebrum, or literally translated an abnormal condition of clot pertaining to the cerebrum. Usually it's some kind of blood clot that is in one of the blood vessels of the brain, usually after a stroke of some kind. Another word part that we haven't been introduced to before is seal. C-E-L-E, as a suffix, and it means protrusion. So it's kind of a sticking out in some way. Oftentimes a hernia, if you know what a hernia is, has the suffix of a seal. So a meningiocele would be a protrusion of the meninges. So what that means is those outer coverings of the brain and spinal cord stick through or are pushed through the skull itself. A meningomyelocele just means that you have a protrusion of the meninges and the spinal cord, usually through some kind of birth defect. You could also reverse the word roots and call it a myelomeningeocele as well. Other things to point out on here, you already know that the suffix pathy means disease. So mononeuropathy would be a disease of one nerve or affecting, one specific nerve, like carpal tunnel affects the specific nerve in the wrist. And lastly, neuralgia. Algia, if you remember, means pain. So neuralgia is nerve pain. So here's a little cartoon that illustrates a meningomyelocele. So this is where you have a protrusion of the meninges and spinal cord through either the skull or the vertebral column. And as mentioned, this is usually a birth defect of some kind. So spina bifida is one example where there's a deformity in the vertebral bone itself, allowing this protrusion to take place. Continuing on with the list, there's nothing on here that is new or not introduced previously. We have a number of itises, omas, and pathies here. The longest one I would say is rhizomeningeomyelitis, which just means inflammation of the nerve root, the meninges, and the spinal cord. When we're making these terms, you could have, several word roots strung together in one word, such as this. The last one is a little bit tricky, a subdural hematoma. Subdural just means that it's pertaining to below the dura, and then hematoma literally means a tumor of the blood, but in this case, in real world terms, a hematoma is a collection of blood. So there's some kind of broken blood vessel and there's a pool or collection of blood. So a subdermal hematoma is a blood pool underneath the dura. There's a picture example on page 657 if you want to see. At this point, since there's so many words, take some time to work through the exercises before you move on to the ones that are not built from word parts. Here's the first part of the list for diseases and disorders of the nervous system that are not built from word parts. The first one, and one of the most famous, is Alzheimer's disease. This is an eponym. It's named after Aldous Alzheimer, who, discovered or first recorded the instance of this disease. And it's characterized by early dementia and confusion. Basically, you start forgetting things, and eventually you lose your memory, and your brain begins to, atrophy and waste away, and then eventually leads to death. And it is abbreviated AD. The next one is amyotrophic lateral sclerosis, or ALS. This is also called Lou Gehrig's disease, and this is a progressive, meaning it gets worse over time, muscle atrophy, so your muscles begin to waste away, and this occurs because the neurons get scarred. So there's a scar tissue that builds up and prevents the nerves and muscles from communicating, and therefore the muscles begin to waste away, and so you slowly lose the ability to move and control your muscles. Bell's palsy, or Bell palsy, I'll show you a picture later on, but it has to do with paralysis of the cranial nerve number 8, Usually this happens on just one side of the face or the other, because the nerve innervates both sides of your face, and it leads to facial paralysis on one side of your face. So you'll see drooping eye, lip, cheek. The next is cerebral aneurysm. So an aneurysm is where you have a blood vessel kind of explode. And if you have a cerebral aneurysm, that just means that it's taking place in the brain. A cerebral embolism is a blood clot that has broken off from another area of the body and has landed and lodged itself in the cerebrum. And then that blockage of blood supply could eventually lead to cut off blood supply, cut off oxygen, and brain damage. This is also could potentially lead to a stroke. And I'll pinpoint here, we learned about a thrombosis in the last group of words, and that was a blood clot. An embolism is basically the same thing. It's a clot, but it has broken off from one location and moved to another. Cerebral palsy is a condition where again, you lack muscle control, but this is not due to scar tissue like ALS. This is due to a brain defect or a lesion in the brain upon birth. And you again have a lack of muscle control and can lead to partial paralysis. Dementia is a very, very general term. You can have Alzheimer's dementia. There are a few different other kinds that you could have as well, but it generically means that you have a loss of brain function in some way. So it could be, short-term memory. It could be you're unable to, for reason or perform complex tasks, that type of thing. There's many different causes. Epilepsy is where you have recurring seizures. This is another generic term for a lot of different disorders, but it has to do with malfunctioning electrical activity in the brain that then lead to these reoccurring seizures. The last one on the list here is hydrocephalus. So hydro means water. So it means that you have a buildup of, water, in this case is cerebral spinal fluid, that builds up in the ventricles of the brain, and this excess fluid buildup can lead to brain impairment. Continuing on with the list, we have intracerebral hemorrhage. Intra means within, so this is a broken blood vessel or a hemorrhage within the cerebrum. So a blood vessel that runs through the cerebrum broke, and you now have a bleed in the cerebrum. Multiple sclerosis, or MS, is a chronic degenerative disease. So this is something, long-term, where you have sclerotic patches that kind of go along the brain and the spinal cord. And because this is chronic, you kind of have episodes, symptoms can fluctuate over time, and usually the symptoms include, fatigue, balance issues. You might have some vision problems or numbness. Parkinson's disease, or PD, is a disease where you have, again, degeneration in the central nervous system, but it's mostly associated with tremors. So your hands and your feet begin to shake. You have trouble changing gaits, like going from running to walking or from standing to sitting. But the tremors are really the most easily recognizable association with Parkinson's. Michael J. Fox is probably one of the greatest examples of Parkinson's. Sciatica is an inflammation issue. So the sciatic nerve that runs, from the base of your spinal cord all the way down the back of your leg is the sciatic nerve. And when that becomes inflamed, it can cause pain in your leg, in your foot, in your toes. And this could either be from an injury, some kind of infection, or maybe you have arthritis. and that excess pressure causes pain. Shingles. Shingles is caused by the herpes virus, and this is what you get, after you have chickenpox. This is what you get when it comes back, and it gives you those little itchy blisters. We saw shingles back when we had the integumentary system chapter in chapter 4. A stroke is where you have a blockage of blood supply to a certain region of the brain, and you're cutting off necessary oxygen that can lead to death of those cells. There's a few different ways in which you can have a stroke. You can have an ischemic stroke where their blood vessel is blocked. You can have a hemorrhagic stroke where excess bleeding has caused a stroke. There's a few other ways in which this could happen. A subarachnoid hemorrhage is SAH. This is again a bleed in the brain, and it's just telling you where it's happening in the subarachnoid space or below the arachnoid layer of the meninges. The last one is a transient ischemic attack. So ischemic means that you are blocking off blood supply, or in this case oxygen. So transient means that it's a sudden attack. It's not something that builds up over time. And in this case, you have a sudden deficient supply of blood, and this only lasts a very short time. And so it might be similar to a stroke, but not necessarily as severe if the blood supply is not cut off for a prolonged period of time. You're not going to be expected to know this particular slide. I just wanted to highlight the few different ways in which an individual could get dementia. The number one cause is Alzheimer's dementia, but there are, many different avenues by which someone could get dementia. Feel free to investigate these on your own if you'd like. Here's an example picture of what Bell's palsy looks like. Again, it has to do with cranial nerve number 7 being affected. Sometimes a small stroke can lead to Bell palsy, and this could also be fixable in terms of being rehabilitated, or depending on what was wrong with cranial nerve number 7. If you alleviate the pressure or the pain, then you might regain the function in that nerve to, get rid of that droopiness. This is an example cartoon of the two main ways that you can get a stroke in the brain. The left side, you have a hemorrhagic stroke. You have some kind of blood vessel or aneurysm, in this case, that ruptures, or a ruptured blood vessel that leads to a bleed, and that bleed cuts off supply to a certain area of the brain, and that leads to the stroke. Alternatively, you can have a thrombosis, which is a buildup or blood clot that stays in one location and blocks off blood supply. You could also have an embolism, which is a blood clot that breaks off and lodges itself in another area, cutting off blood supply. All of these are ways in which one person could develop a stroke. Here's a picture of what the viral disease shingles looks like. You get painful blisters, and those painful blisters can affect the nerves that are underneath the skin in those locations, which is why it is found here in the nerve chapter as well as chapter 4. Next up, we are moving on to surgical terms. There's only a handful of them, and they are built from word parts. Whenever you get to surgical terms, the key part of the word is going to be in the suffix to tell you what type of procedure is taking place, and then the word root tells you where. So reviewing, ectomy, as in ganglionectomy, is a removal. So in this case, you're removing a ganglion. Or neurectomy means you're removing a nerve. The suffix lysis, L-Y-S-I-S, means dissolution of, so you're breaking up or getting rid of. Neurolysis would be dissolution of a nerve. The suffix plasty is surgical repair. In this case, a neuroplasty would be a surgical repair of a particular nerve. Raphy, in neuroraphy, means suturing, so you would be suturing up a nerve. Tomy or tomy, as in neurotomy, neurotomy, and radicchiotomy, rhizotomy. Those all mean incision. So it's just telling you where you are inserting. So a neurotomy or neurotomy would be an incision into a nerve. We're now going to move on to the diagnostic terms. So these are the types of scans and images and procedures that doctors are going to be using to diagnose a particular condition. The first term is cerebral angiography. So the suffix graphy, it means recording or the process of recording. The product of that recording would be a gram or a graph, depending on what you're doing for the imaging. But graphy means recording or the process of recording. In this case, you are recording the blood vessels in the cerebrum. Usually how this is done, there's a picture at the right there. They inject some kind of contrast medium into the brain or into the blood vessels, and then when you take the pictures, then you can see that contrast and therefore see any potential blockages if you're not being able to visualize the vessels in a certain area. The other term is CT myelography. So again, we have a graphy, so it's a process or recording. And recording could also mean taking a picture or a visualization. Here they're going to, again, inject some kind of contrast media, and then they take a CT, so it's a radiographic image or an X-ray, and it'll tell you the size and the shape and position of the spinal cord. That gives you an idea of any potential issues. In the bottom part of the slide, we have neurodiagnostic procedures. So these are other neurological disease procedures that you would do. And they're all very similar. We have electroencephalogram, graph, and graphy. The first part of the word is the same for each time. We have electro and encephalo. So it has to do with the electrical activity of the brain. The suffix gram is the record. So that's the picture or the recording that you get out, abbreviated EEG. The graph is the instrument that you take the procedure with. And graphy is the process. So when you put it all together, you would do a graphy procedure with a graph instrument to get a gram, the picture. It's a little tricky at first, but once you get those suffixes straight, then it's going to be consistent throughout the whole textbook. Here, make a special note of the suffix. So this is the process of recording. Ask yourself whether or not that would be gram, graph, or graphy. And hopefully you think to yourself that the process is graphy. So myelography would be the correct answer here. Here's a list of certain procedures that are not built from word parts. We're going to spend some time towards the end of the semester focusing in on different types of scans and how they are all different. But here they are just mentioned in brief detail. So in order to look at the brain and spinal cord, you can do three major different types of imaging. The first is a CT scan, and this is the abbreviation for computed tomography. It's similar to an X-ray, but it's an X-ray taken in many different planes, so then you can put it together in a bigger image to visualize. You can do an MRI, which stands for magnetic resonance imaging. So in this case, you are using magnets instead of X-rays, and you put a bunch of serial images together to visualize things like tumors or herniated discs. The last is a PET scan, or PET, stands for positron emission tomography, and this is a nuclear medicine procedure. So you would ingest or be injected with radioactive chemicals, and then you would have a CT scan, so an X-ray, that would then take pictures with those radioactive chemicals to get a picture of blood flow and metabolic activity through the brain and spinal cord. In terms of neurodiagnostic, you can have an evoked potential study, or EP study. So this is basically a measure of your brain waves in terms of visual, auditory, and somatosensory visualization or stimuli. This would be looking for certain things like seizures, and also sleep disorders, things like that, where you would have a change in your electrical activity in the brain. The last one is a lumbar puncture, or LP. This is where they stick a needle into your lower back in the subarachnoid space and then suck out some cerebral spinal fluid to then perform tests on. And this is also called a spinal tap. Here's just a picture representation of what the three different types of scans are. Again, a CT is basically a cross-sectional X-ray. An MRI gives you an image using magnets instead of X-rays. And the last is a PET scan. So they're using radioactive chemicals combined with the CT scanner. Here's a picture of what a lumbar puncture or spinal tap looks like. So you would lay on your side to make the puncture site visible. Usually they do this between the L3 and L4 vertebrae, and then they stick the giant needle that goes through to the subarachnoid space and take out some cerebral spinal fluid. Next up, we are moving to complementary terms. There are several from word parts as well as not from word parts. This list looks rather long, however, it is composed of all the word parts that we've been using several times by now, so hopefully it doesn't look too super hard to memorize. The suffixes that were introduced to this chapter include asthenia, which is a feeling or sensation. We also have aphasia, which has to do with speaking. So for example, aphasia means there's no speaking, whereas dysphasia would be painful or difficult speaking. Algia means pain. Sight is a cell. I want to redraw your attention to the difference between paresis and plagia. Paresis, again, is a slight paralysis, whereas plagia is a full paralysis. So if you have monoplagia, that would be paralysis of one limb. Whereas if you had, panplagia or paraplegia, that's a little bit different, and I'll show you what that is on the next slide. The one suffix that I'm not sure if we've discussed before is sclerosis. as in encephalosclerosis, and that means hardening. So encephalosclerosis would be a hardening of the brain, so it's losing that, sponginess, and is associated with its own signs and symptoms. So the different types of paralysis here, we're going to talk about total paralysis with plegia. I could use the same for slight paralysis and use paresis. Now in picture 1 at the top, it would be half the body. So this would be hemiplegia or hemiparesis. If you're just talking about paralysis from the waist down, that's what we call paraplegia or paraparesis if it's just a light paralysis. And then when you are paralyzed from the neck down, meaning all 4 limbs are paralyzed, we would say quadriplegia, meaning all 4 limbs. Similarly, if it was your entire body, you would be panplegia, which is you are totally or completely paralyzed. Here we have the terms that are not built from word parts. The first is afferent, and it goes with the word at the second top, efferent, and it has to do with where the nerve impulses are going. So afferent, think away. It is the impulses that are being carried from the central nervous system away toward the extremities. Efferent is the opposite. Those are the ones that are coming back to the central nervous system from the extremities or the other parts of the brain. Ataxia means without muscle control. So the diseases and disorders in which you lose control, like muscular dystrophy, ALS, and so on, they experience ataxia. They cannot coordinate their muscles. Cognitive just means that it pertains to mental processes like comprehension, memory, reason, things like that. So when your cognitive abilities are diminished, you might have dementia. Coma just means that you are in a profound state of unconsciousness. And conscious means that you are awake, alert, and aware of your surroundings. When you're no longer awake and alert, then you are in a coma. A concussion is trauma to the brain, and this could be minor or major depending on what the injury is. But you usually have a really bad headache, you might have lost consciousness at one point, and you can have other things like vertigo. Convulsion. A convulsion is the fancy word for a seizure, and I shouldn't say that. Not all seizures have convulsions. Oftentimes those words are used interchangeably, but they're not exactly the same. A convulsion is when you have involuntary contractions of your muscles. So certain types of seizures have convulsions. Other seizures don't. Disorientation means that you're basically confused. You don't necessarily know the time or place or identity of something. And this could come as a result of a disease or a head injury. Dysarthria is the inability to speak in a coherent way because of the muscle control around the nervous system. Basically what that means is the muscles cannot coordinate the ability to speak in a coherent, logical manner. Next we have gait. Gait is the manner or style of walking. So we have a running gait, we have a walking gait. Usually this term is going to be used in association with Parkinson's disease because they have an extreme difficulty transitioning from one to another. Incoherent means you can't express yourself in a intelligible or logical manner. So if you are incoherent, you would be saying things that someone else wouldn't be able to understand. So that's a little bit different than disoriented. Disoriented means you're confused. Incoherent means you're trying to communicate, but what you're saying does not make sense. We talked about paraplegia before. A seizure is any point when you have a surge of electrical activity in the brain. Sometimes that's associated with a convulsion, but not always. A shunt is a little tube that's stuck in usually a blood vessel or somewhere in the body to redirect fluid flow. So if a blood vessel is blocked in some way, they might insert a shunt to help open up blood flow. Next, we have syncope. Syncope is fainting. So you suddenly lose consciousness because of a lack of blood supply to the brain. For example, maybe you stand up way too quickly and the blood flow is low to the brain at that point and you faint. Finally, unconsciousness. Unconsciousness means you have become unaware of your surroundings. You can't respond to stimuli when presented. This could be a few seconds, it could be days, weeks, a profound unconsciousness that is sustained for long periods of time. That's when it transitions to a coma. Because the nervous system involves the brain, they lumped all the behavioral health terms in this chapter as well. So we're going to start with the terms that are built from word parts, and then in the list that is not built from word parts, that's where we're going to have most of the, psychological diseases and disorders. I want to differentiate the word psychiatrist and a psychologist. They are different. A psychiatrist is a medical doctor or a physician, and they've had additional training on experience in prevention, diagnosis, and treatment of mental disorders. So they're a specialized physician, therefore they are able to prescribe medication and medical tests and treatments if they see fit. Whereas a psychologist is a person who has gone to grad school or graduate school and studied psychology. They're not a medical doctor, but they do have training in clinical psychology, and their job is to provide testing and counseling for mental health and emotional disorders. So they, are someone to talk to, but they are not necessarily, they're not a medical doctor, so they can't prescribe certain medication or medical tests. Other terms on here that are put together from word parts: psychogenic. If we remember from a while back, genic means producing or originating. And so a psychogenic disorder would be originating in the mind. Psychopathy is any disease of the mind, so that's a generic term. It's kind of misused if you say someone's a psychopath. That's just a general term for someone who has a disease of the mind. Psychosis, or plural psychoses, is abnormal condition of the mind. So this is where you have some kind of major mental disorder. Usually you have some kind of delusion or hallucination, some kind of psychotic break. The final one is psychosomatic. Psychosomatic means that it's pertaining to both the mind and the body. So psychosomatic disorders are usually, mental disorders that originate in the brain and then manifest themselves in some kind of body way. For example, some women, if you truly believe that you're pregnant but you're not really pregnant, you can, start to gain weight and have symptoms of pregnancy even though you're not really pregnant. That would be an example of a psychosomatic disorder. here's the list of all the different behavioral disorders that are covered in this chapter. You will be expected to know these as well. And if you've had psychology class or even health class, these are probably pretty familiar to you. So anorexia nervosa is an eating disorder, and that is where you do not eat food. So you have, this horrible body image. So you are so afraid of gaining weight that you just don't eat food. Whereas bulimia nervosa is also an eating disorder, but that one is characterized by binging on food and then purging it later. An anxiety disorder is an emotional disorder where you have feelings of tension, you get uneasy from either anticipating something that's not really going to happen or something that you imagine. So you're just really anxious and on edge all the time. The next is ADD, or ADHD, which is attention deficit hyperactivity disorder. And that one you're probably all familiar with. So it's technically a learning or behavioral issue where you are just unable to sit in a spot for a long period of time and stay focused. Autism also is called autism spectrum disorder, just because there are varying degrees of autism to which someone can have. But it includes things like preoccupation with subjective mental activity. So basically that means that you can laser focus in on certain things. You usually are unable to interact well socially, and you have trouble communicating. Again, that's a spectrum disorder, so some people are very high functioning and others are very low functioning. Bipolar is a psychological disorder where you have two major extremes in your mood. So you're either manic or super happy or depressive, and it kind of has alternating episodes of both. Major depression is another mood disorder, and you are, sad to the point where you don't want to even get out of bed in the morning. And that's also called clinical depression or clinical depression mood disorder. Next, you have OCD, or obsessive compulsive disorder. So this just means that you have this tendency to perform repetitive acts or rituals usually. Those are compulsions. And it creates a lot of anxiety for the person. And there's different degrees of OCD or different things. Maybe you need to open a doorknob and close it 5 times, or turn the light switch on and off, 10 times, wash your hands a bunch of times, keep everything neat and tidy. It just makes you really anxious when things are out of place, that kind of thing. A panic attack is a sudden onset of, extreme anxiety. It kind of comes on unpredictable in nature, and you might, get sweaty, have chest pain, feel dizzy, but it can be overcome over time. So a panic attack is something that's kind of a sudden onset. You have this episode, and then it will go away. Phobia, you're afraid of something. So it's kind of this crazy, irrational fear of something. Pica is an interesting one. It's the compulsion to eat non-nutritive substances. So you're eating stuff that's not food, whether it's clay or ice or hair or pennies. It's any random thing that's not food. And strangely enough, that's usually caused by an iron deficiency. So then once they figure out what's wrong with you and give you iron, then that condition is fixed. The next one is PTSD, or post-traumatic stress disorder. And that is where something traumatic has happened to you, and after that you now have this really debilitating emotional response to little things that remind you of that traumatic event. Common with, soldiers coming back from battle, as well as any individual that might have been in a stressful situation. Schizophrenia is kind of an umbrella term for many disorders, but you have distorted reality. You can have delusions, hallucinations, and other disturbances. You're withdrawn from society and so on. The final one is a somatoform disorder, and this is where you have some kind of disorder that has physical symptoms, but they have no physical cause is known to exist. So you have physical symptoms really for no known reason at that point. I would encourage you to try exercise 42, matching the disease with the definition. That's about as in-depth as I would ask you to go on these particular terms. The last chart in your book on page 688 is going to be the list of abbreviations that were used throughout the chapter. I just want to point out these are all the abbreviations, and they were highlighted throughout the chapter with their full-length word. You will be expected to know these, either if I give you the definition or the full-length word, you should be able to give me the abbreviation, and vice versa. That's why exercise 44 is a good prep for the testing situation on abbreviations. As we wrap up every chapter, I would encourage you to try to read this paragraph out loud and truly comprehend what it is saying, as well as pronouncing each one of these words correctly. If you're having trouble pronouncing them, there are phonetical spellings on page 692 to help you pronounce these.